many people that has been affected, people that, had either lost jobs or, seen for 2 weeks or 3 weeks, his income cut down.
Address issues like low vaccine uptake in racialized community. Those in the community say it's not an issue of health. Those in the community say it's not an issue of health, citing the rising cost of living during the pandemic. Our next guest is part of a group in the Greater Toronto Area trying to address some of the barriers that the community is facing and helping provide more reliable information about COVID-19 in their own language. Dr. Anay Perlas is an anesthesiologist and a volunteer physician, member of the Latin American COVID-19 Task Force. Thanks so much, Dr. Perlas, for being with us tonight.
Thank you very much, Janella, for having me here.
So I want to look at some of the numbers from Toronto Public Health. Let's bring up that graphic, and the gray line in the middle there shows that's the overall case rate per 100,000 people in Toronto, and that's about 2,500 cases. And they compare that to that pink graph there. That's more than 7,000 cases per 100,000 Latinos. So relative to their population, Latinos in Toronto are making up a huge percentage of cases. So the big question is why? What do we know about what some of the factors are that contribute to this?
Thank you. We actually have some recent official data that tells us that the majority of Latinos that contract COVID-19 do so from two different sources. Number one, from work, and number two, from close contact family members. So what we think is going on is what we call these social determinants of health that are at play. What does it mean? It means that through no fault of their own, many members of the Latin American community see themselves in situations in which they make them more vulnerable to contract COVID-19. So a large proportion of the Latin American community are employed in the service sector, large manufacturing plants, repairs and services of that kind, also in large construction sites and related trades. Outside of Toronto, we have a large number of Latinos employed as migrant farmers in the farming sector. And these are all jobs that cannot be done from home. They have to be there. They're frontline jobs. They keep our economy going. And by that nature, it makes them much more vulnerable to contracting COVID-19 because they have to be in contact with many more people by the nature of their jobs. It's second, it's not unusual in the Latino community to have large family groups. Many times are multi-generational, with many people living in the same household. And again, the people that are working bring the virus home, and then there are many of them that get infected in the same family. We see these in the hospital very often.
Yeah, and let's show another stat. Again, Latinos, the highest among number of hospitalizations relative to their population. And like small in Toronto, they only make up 3%. So what's your biggest concern when you see it's not just cases, but also hospitalizations, meaning that these are more severe cases?
Yeah, we find this very concerning. To be honest, we don't know exactly why that is the situation. Anecdotally, I have heard from many of my colleagues that sometimes Latinos, because many of them may or may not speak the language English so well, so they lack some information as to where and how they can find help. And sometimes when they present to hospital, they present with already quite advanced cases of the disease, which again puts them, more at risk of more complications.
So we mentioned you're with the Latin American COVID-19 Task Force. So what are some of the things that you guys are doing to try to help overcome some of the challenges and barriers that you've identified?
So we are trying to provide reliable and accurate information to the community in the Spanish language about the COVID-19 pandemic, about the official efforts to combat the pandemic, and in particular about the effectiveness and safety of the vaccines to try and increase awareness and encourage vaccination in our community. The way we do that is we are working closely with the Spanish language media already existing in the GTA area, television channels, radio stations, the written media, as well as social media, especially. We have a Facebook presence, Instagram, and we have a website, latinoscovid.org, that provides this information in the Spanish language.
Just quickly, is there anything more you would like to see from government officials or health officials?
Well, I think the three levels of government are doing a good job considering the very difficult task at hand. If they wanted to tackle this particular community, I think there's two things that could be helpful. One is they could leverage, just like our group is doing, they could leverage the existing media in the Spanish language that we have in the city in order to reach a larger proportion of the community. And secondly, I think more mobile units of vaccination tailored specifically to these large working sites with a lot of workers that cannot be home. I think that would go a long way to improving the situation in the community.
All right, Dr. Anay Perlas is with the Latin American COVID-19 Task Force. Thanks so much for your time.
Thank you very much for having me here.
Well, in Quebec, the English Montreal Board says